Hello, everyone. We are so glad that you decided to join us on this wonderful summer evening for 30 minutes. I'm Nikki McCutchen. I am your host, and thank you for taking time out of your schedule to be with us this evening. The call will just be for 30 minutes, so we will make it short and sweet. But just know whoever invited you to the call this evening must really care about you to want you to know about this technology. And so we are super excited to share with you what we have learned and what we experienced through this amazing product called X39. But before I get started on that, I just want to do our medical disclaimer. Tonight, what we'll be sharing is for educational and informational purposes only. All LifeWave products are not intended to treat, cure, diagnose, or prevent any kind of disease or illness. If you are pregnant or nursing, please check with your physician first. We always recommend that you check with your healthcare practitioner as you decide to embark on any kind of health journey that you go on is the recommendation. So anyway, what we are going to be talking about is this tiny little patch that looks like a little Band-Aid. It's just a crazy, crazy little Band-Aid that you pop on your body that is this amazing technology called phototherapy or photobiomodulation. And that just means it's a big word for light making change in the body. And so you all already know exactly what this is because every time you step out into the sun and the sun hits your skin and your eyes, it causes your body to make vitamin D. It tells your body for the vitamin D in your body to do what it was designed to do. And so, um, one of the ways so how this works is that little tiny patch, that little white structure in there is reflective. So it is a crystal lattice structure that has a reflective quality to it that is made up of amino acids. Water, salt, sugars, all stereoisomers. So at the molecular level that are reflective. The patch is completely sealed on both sides. So it's non-transdermal, meaning nothing transfers from the patch into your body. Most people know about things like a nicotine patch, an estrogen patch, a vitamin patch. All of those things transfer something from the patch into your body, causing your body to do something. And so with this patch, that's not what happens. Has that reflective quality that reflects back into your body, your own body's infrared light. So the way you know that infrared light is coming off of our body, you probably never thought about it, but when you see a movie and they're doing something with night vision goggles and they see those heat signatures, they call them, with all the different colors, that's actually low-grade infrared light. And that's coming off of our body everywhere. And so this patch actually reflects that low-grade infrared light at a specific frequency, signaling different peptides to tell them to get up and get going and get moving to do what they were designed to do in the body. So because that infrared light comes out of our body from everywhere, you can actually place the patch anywhere you want to. We do have over 90 clinical studies and over 150 patents, so there are clinically tested spots. But the technology has been around for over 20 years now, and so we know that you can place it anywhere that you want to on the body, and it will work no matter where you place it. So the most important thing is that you just put the patch on your body so that it can do what it was designed to do. The recommendation is 12 hours on and 12 hours off. So for me, when I get up in the morning, I put the patches on my body, and when I brush my teeth, and at night when I brush my teeth to go to bed, I take them off. And then the next day, I wake up and I put on brand new patches. So 12 hours on to activate and repair, and 12 hours off. The other reason that we wear them for only 12 hours is a phenomenon called attenuation, which means your body just gets used to that light signal or that frequency. And so it needs time off from that so it doesn't stop working. So your body doesn't stop doing what it needs to do. When we're signaling the body, it's time for these peptides to get up and get working. So this amazing peptide that the X39 product activates is called GHKCU. And that in particular peptide does all kinds of amazing things in our body. And so when we can get that peptide up and going, you can look at PubMed, you can pull up reverse aging with GHK.com. This is also one of Lauren Picard's book, GHK Copper Peptide. I just got it on Amazon, that just talks about all the things that GHK CU does in the body. One of the things that it does that makes it so amazing is that it activates dormant stem cells. So as we age, our stem cells go dormant. That's what causes the natural aging process in the body where aches and pains kick in, different issues kick in. So by the time we're 30, half of those stem cells go dormant. By the time we're 60, we only have 10% of those stem cells active any longer. They're not gone from the body, they've just gone dormant. So if we can wake those up and tell them to get working again, it will help to reset our body to a younger, healthier state. And so when those what's really cool about those stem cells is they can go and do anything in our body that our body needs for support. And some of the other things that help with that this GHKCU does in our body is it supports our cardiovascular system. So every part of our cardiovascular system, so our heart, our blood vessels, the lining of our blood vessels. So this is why people will report having better blood pressure, feeling better, having better heart health, because now they're being supported with a peptide that works in those areas to balance out that cardiovascular system. Every 6 months that you utilize the technology, it can reset your body by your vascular system by 8 years at the molecular level. That's truly phenomenal. And I don't know about you, but I want my cardiovascular system to work as optimally as it possibly can. Another thing that GHKCU does is wound healing. So any type of scrape, nick, surgery, it remodels scar tissue. So if you have surgery, I actually have that on my own body. My doctor and my physical therapist were just completely shocked at how quickly my scar healed up, as well as like to hardly be able to see the scar anymore. Very quickly, within like 6 weeks, you could hardly even, I mean, you really couldn't even see the scar. So collagen, our bodies, every part of our bodies need collagen to work the way that they've been designed. So most people just think of it as hair, skin, and nails. But it also is for our muscles, for our bones, for our tissues to work properly. There's a lot of people that take collagen, and you have to really work hard to find a good collagen product that has all 5 types of collagen in it. But anytime you're taking something exogenously, it will never be superior to what your body was made and designed to do on its own. So if we can help support our bodies to work at an optimal level on their own, that is going to help us in every single way. By the time you're about 3 months of using 6 weeks to 3 months in there, you're going to start noticing changes in your skin, in your hair, in your nails, just being different, smoother, brighter. I know I've had more hair growth. My eyebrow hair has started growing back in. So I've had all of these, I've had people comment on my skin. So I've had all of these really great results from that too, that I wouldn't have necessarily wanted, to like would have done something like this for that. There's a lot of people that would, which I am applauding, and that's fabulous. And it's a wonderful added benefit for me. But for me, it would have been more about my energy. And that's something that really changed for me, was just to have more energy and more vitality, that I wasn't tired all the time. If that would have been the only thing this product did for me, I would have been sold and would never stop wearing it, just to have the energy to feel like I just don't want to sit down and go to sleep all the time. So I am so very thankful for that. Another thing that it does, it supports your immune system. We live in a toxic environment where there are toxins in our air, in our water, in our food. And so it is very important that we support our immune system. It's our immune system that helps keep us in a state of health and being able to do all the things that we want to do in life. And so to be able to have this peptide support that as well. Again, you can see why this being able to activate this peptide does so many things in the body, that it is so worth our time and our energy to learn and investigate why this might be something that we want to consider for ourselves. The recommendation is that you wear the product for 1 month for every decade you are old. So if you're 50, you would want to wear it for 5 months to really see what it's going to do for your body. Because this is a completely natural thing that our bodies do, it took us a long time to get in whatever state we're in, whatever issues we have, whatever we're trying to help and support and make better. It took us a while to get there. So it's going to take us a while to help have the support that it needs to maybe not have some of those issues anymore. And so 5 months for a 50-year-old would really be what we would say is a good time frame to really see what it's going to do for your body. Some people have react very quickly to the product and they notice things very quickly. Other people, it takes that length of time to really see what it's going to do. And just because you're not noticing anything going on with the product doesn't mean it's not working. Because think about it. If you have something going on with your heart or with your liver, and your body decides to tell those stem cells, this peptide gets up and going, tells those stem cells to go and help the heart, to help the liver, those are things you may not necessarily fix, especially, or may not necessarily know you need help with, because that's not something that you have had issues with or know that there's even an issue there. So I don't know about you, but I want something to be working on my behalf, to helping my body work more optimally, bringing my body back into a state of homeostasis that has no chemicals, no drugs, not forcing my body to do anything, but just supporting my body in doing what it was already naturally designed to do. So I think I got through everything with that. Does anybody have any stories they want to share with us of what you've noticed on using the technology, or if you have any questions? That's what I'm here for. Vicky's here for us just to be able to answer your questions. Maybe we want to start with Jennifer. Vicky, what would you say? I'd love for you to come on and just tell us a little bit, like if we're unable to affect someone's, pain or something like that. This weekend, I actually patched a guy who he was getting ready to have knee surgery. So he had on a knee brace. His knee was kind of swollen. He had a ton of knee issues. Let's see, I used Eon and X39. So Eon is our anti-inflammation patch that activates a peptide in the liver to reduce inflammation systemically. And I, of course, use Ice Wave. I may have only put one set of Ice Wave on him, but I had put an Eon on the C7. And then I put, I think 3 or 4 Eon around where I'd put the Ice Wave and like tucked them in his knee brace. That's the other thing is that's so cool is that people can get results, and the patch again is not on their skin. They can put it on their clothing. Like I said, I was just tucking them in his knee brace because again, nothing transfers. It's all worked on through light frequency. So Vicky, would you have any tips or tricks for us for maybe helping? I was giving them water. We were out in the heat. He was the only one that I patched that I did not get some kind of pain relief for. So I was anxious to hear what tips you might give me.
I would definitely try the 4 gates with the energy enhancer.
Okay.
You could actually, because it is painful, you could use the Ice Wave in place of the energy enhancer. So do the 4 gates if you want. It's totally up to you. It's the 2 patch system. So put it on the hands and the feet, and just I would definitely add a carnosine, because anything below the waist, any kind of pain, I always use carnosine for that.
Okay.
So it's I don't know why, but I have great results with that. And yeah, I love it, especially if it's like muscle and tendon related.
Would
Yeah, and
you use more than one carnosine? Because I don't normally carry the carnosine with me when I'm doing something like that, but obviously maybe I need to start carrying it with me.
you can use more than one carnosine. That's not going to really affect it. You could try the 3YH also around, you said it's his knee.
Yeah, it was his knee.
You the 3YH around the X39 on the knee.
Okay. Yeah.
And
So Jennifer, do you know what the 4 gates is if you want to try it on your dad? So she's talking about on your hands, right, Vicky, to have the right spots here and here, white on right, tan on
yeah,
left, on those
yeah,
spots on your hands. And then where's the other? Here?
that's large intestine 4. And then you want to do liver 3 on the tops of the feet.
Oh, the tops of the feet. Okay. So Jennifer, if you just look up liver 3 point, like acupuncture liver 3 point, it will show you exactly where that is on the top of the feet. And is that also the energy enhancer, Vicky?
Yes. And large intestines 4 are the ones on the hand.
Okay, so these are large intestine 4 here, white on right, tan on left with energy enhancer. Or like Vicky said, you could also use the Ice Wave. I don't know if you have energy enhancer, Jen, so you could use the Ice Wave instead, and then look up liver 3 acupuncture point on the top, and it'll be on the top of the foot. And that'll also be white on right, tan on left.
Yes.
Okay, so are you saying use the just the energy enhancer?
You'd still use the Eon and the X39 as well.
Okay. Okay,
Yeah.
I'll do that tonight.
Yeah. So Vicky, would you say Eon still at C7, and where would you put the energy or
Yes.
the X39? Okay.
I would start with the 4 gates. So that's going to be the energy enhancer. Start with that and, keep it on. I would say at least maybe a half an hour or so. Have him drink some water and then do the Eon on the back of the neck.
Right.
I would do the glutathione and the carnosine around the knee, and then place
Well,
the
I don't
extra.
know if it's her. This is her. I don't know if her dad where he's hurting. So that was just my person. But Jen, where's your dad hurting?
My dad is his lower back.
Okay. So yeah, you can do the lower back. You can just place the carnosine and the glutathione, and then put the X39 right on the tailbone. So on one side of the X39, you place the carnosine, and on the other side of the X39, place the glutathione. So it's like in a little line across the tailbone.
Okay.
And then Eon goes on the back of the neck, the C7.
Gotcha. So can I also do those in conjunction with silent nights, or does silent nights need to be alone?
Silent night can be, you're going to do that at nighttime though, right?
Right. So I can't do these others at night with it.
Well, you can, but you're not really going to notice it. Like, he might not notice if it's going to like really be effective. So is he in more pain in the evening or during the day?
Okay. And that's what I was trying to kind of like do them one at a time. But then when he said they weren't working, they didn't work. So I thought, well, he hasn't been on them for a day. So I thought, well, I'll try the silent nights tonight. And then I
Yeah.
guess I'll try the others in the morning.
Yeah, that would be great. That would be a good idea.
Okay.
Awesome.
And if hopefully he gets results from that. If not, then I would definitely suggest, Nikki, I would definitely suggest the severe symptom or the cellular regeneration detox.
Okay. Yeah, sometimes Jennifer, people's bodies just get stuck. They get very stuck. And so that cellular regeneration, well, severe symptom and then cellular regeneration, it's a 20-day protocol. Because like I said, our bodies can get so bogged down with toxins, and we're trying to get them up and those cells to communicate together again. And so sometimes people don't have the patience and, to do all of that. But at least we know there is something available to us, that we can help people with if they're willing to go, wanting to try those kinds of things. It's like anything else. Anytime that you're venturing into health and doing things naturally for your body, usually it takes some time and some perseverance and a willingness to step into whatever the protocol is and whatever the recommendation is to really try to help your body be supported the way that it needs. And that would be for anything that we try. Even like when you think about exercise programs, if we just go to the gym one day, and then we just decide, well, that didn't work because it didn't make me lose weight, or it didn't, make me feel good. Now I'm just more tired and more sore. And we
100%.
just, yes, we just gave up after one day. We're talking, we just live in a microwave society. And so it's just one of those where anytime we're dealing with something supporting our health naturally, it's usually a mind, shift for people to think through, okay, what am I willing to do to really try to support my body in a way that's going to not cause any side effects, not have any damage, for there's no contraindications, for me just to say, okay, I'm going to do this. I'm going to do this, for 20 days. And then I'm gonna go on some type of maintenance, with just the X39, the Eon, potentially still the carnosine, and ice wave as needed for pain. So anyway, it's something that is at least available to us that we know is there. So and if you need those, I have all of those on my Telegram channel, or I can send them right to you. So Vicki did a really great training one time also on the severe symptom and cellular regeneration that we have recorded too. So that's really good. Does anybody else? Oh yeah, go ahead.
I just wanted to share that I patched for a few months before I actually did the detox. And the only reason why was because I was wondering, okay, this is going to work for me. Everybody else is like, wow, the one patch wonders. You see all these great results. And I'm like, okay, it's going to happen. It's going to happen. And then finally I was like, I'm not really feeling a difference. So I did the detox. And then afterwards, amazing results. Big difference, night and day.
That's awesome. Yeah. And I have Vicky's story. Vicky's story is recorded too, if you want to hear it. It is amazing. So anybody that's dealing with a lot of things, especially women, her story is really great. Because yeah, sometimes we have to take some drastic measures to try to bring our body back into balance. Now I can tell you for me, I'm super healthy. I did not notice anything on the severe symptom protocol and the cellular regeneration. I just did it because I wanted my body to work optimally. And so I know that, based on acupuncture, how, that works and how that's designed, it's supposed to just help open up all my meridians and cause everything just to work better. So I did it just a choice for health, not necessarily because there was something that I needed help with. And I know Vicky makes really great points too, and I had never thought about it, but if you're coming down with a cold or something, or have allergies kick in or something like that, that to go to that severe symptom protocol or cellular regeneration right away to help that move out faster, I think is just brilliant because just doing it even for a little bit of time, 5 days or whatever, can be helpful and get you over that cold fast. So, any other questions or stories anybody wants to share? So I have this really cool story. I'm hoping that sometime I will be able to get them to come on and share. But I went today and Patch, I think he's like 13, maybe. He has Osgood Schlatters, so it's a knee condition where the tibia, the connections, and he's just growing too fast. So there's lots of swelling in there, and so when you're patching teenagers, you never, especially boys, like you never know what you're gonna get. I mean, it was the coolest thing. So I put an Eon on the back of his neck, and I had him drink some water. And then I did Ice Wave. I started with the tan Ice Wave right on that. So like they get a knot kind of where the tibia connects, to the knee. And so there's like this knot and this swelling right there that's really painful. So I put the tan Ice Wave right there. And then we used the clock method where we did 12, 3, 6, 9, all the way around with the white patch. Each time I was having him drink water to see which placement he would have the most pain relief, and so he would get up and he would do lunges and he would, and he'd be like, well, yeah, that's a little better, a little better. So we found the best spot for the white one. So then I attached it. I was using tape so that I wasn't wasting the sticky on the patch. And I put it in the spot for him that he liked the best. And then I placed an X39 on top of the tan Ice Wave. And I did that on both knees. And so his mom was like, okay, go jump. They had this really cool balcony thing. And, this boy already at 13 is really tall, which of course, that's why he has Osgood Schlatters because he's growing like a weed. So she's like, go jump up and, hit that balcony thing or whatever, so like he's jumping up and then, that's the landing. It's when you're landing that those knees just like zing you. And I mean, he just turns around. He's like, oh my gosh, like, there was no pain. There was no pain when I landed. And he's like, I just can't believe it. And so it's just so sweet. Here's this 13-year-old boy. He's looking at me and thank you so much for coming over. Thank you for bringing me these patches. I mean, it was so sweet. And the mom is like, this makes me about want to cry because you don't know how many things we've tried to try to help get him some pain relief. For months, we've been trying to get him. We've tried everything you can think of. And now you just come over with your tiny little stickers and he's out of pain. I mean, it was just so sweet and just so thankful that they, let me come into their life and do that for them. And even when I left, he was out playing basketball, and he's waving at me saying thank you. It was so cool. So I just love the fact that we have this amazing technology that we can truly influence people's lives for the better. bring them pain relief. And kids who want to go out and play and he wants to play basketball and he's got lots of energy. And so you want them to be able to do that without pain. And so that was just truly a blessing today for me to get to do that. So, anyway, anybody else have any stories, or please come on and ask questions if you have them.
I have a testimony.
Oh, great.
All right, my name is Eleanor Lewis, and my testimony is yesterday, my daughter have very bad menstruation, and I have patches, so I told her to use the Eon patch on her right ovary and the tan ice wave on her left ovary. And ever
Excellent.
since then, huh?
I said, excellent.
So that was yesterday, and that alleviated the pain yesterday. And today she's good as gold. She has no cramps at all, no menstruation cramps at all.
Oh my
So this is
goodness.
something that we could share to others who are going through these, menstruation.
Absolutely.
In the
Yes. Thank you so
yes,
much for sharing with us. Yes, because your
you're welcome.
story and you telling that will definitely help others. So we appreciate you
She
coming on
tried
and
it
showing that.
before. She tried it before, but she had used X39 and the Eon, but I ran out of the X39. So this time I let her try the Eon along with the tan ice wave, and she still received great results.
Excellent. Yes. So
So it's like it's huh?
You weren't using the X39 at all.
No, I am using the X39, but I ran out of the X39, so I have to reorder X39. But what I'm saying, like yesterday, I didn't have any X39 at all. So I
Okay.
improvised and used the ones that I have at this particular moment, which is basically the Eon and the Ice Wave. But I had her using the Ice Wave, the tan color, and the Eon patch, and that works wonders for her as well.
Yes. That is so great. I don't you just love the fact that even if we don't have all the things, like all we want all these things and all these things are good, but just the fact that some of the things can work together well by themselves is
Right,
just so
exactly.
yeah, yes. And just for you willing to try it. I think that's the biggest thing is I was trying to talk to this mom today and just telling her, you're just going to have to play with it, and find out, what you're going to be able to get away with. Hopefully we'll get that inflammation down so you won't have to use a set of ice wave on both of his knees, to where maybe you could use like what you're talking, like just use, one Eon on each leg. But yeah,
Hmm.
like when I placed that tan patch on his knee like that, he just had the Eon on the back of his neck and then that tan patch on his knee, and he was already getting results. And I hadn't even added the white patch to it yet. So I love that.
Uh-huh. And like
Yes.
with the I actually use is it Vicky? Vicky said that she used the cortisone like on below the waist,
Yes. The
and I've
carnosine.
used the cortisone, sorry, the
No, you're
cortisone
good.
below the waist, and I've used the cortisone on my shoulder because I have like my left shoulder has been having some pains and stuff, but I have been using it on my left shoulder, and that works for me as well.
Oh, that's awesome. That is so great. Isn't it so funny how our bodies are all designed differently? Because when I put carnosine on a spot where I have pain and like, especially like my elbow, but it's not below the waist. So I don't know, but I guess Eleanor, you were saying on your shoulder, but I feel more pain. And so, but then like if I add
Mm.
a glutathione on top of it, then that will help, to simmer it down. But for some reason, the carnosine for me actually it intensifies the pain. So we're all just made so differently, and it's amazing. So yeah, Vicky, please come on.
Thank you so much for sharing amazing testimonial about your daughter. That's amazing. And the carnosine can be worn anywhere on the body also. I just say if there's an issue, anything that you're dealing with that you're trying to help somebody patch for pain, anything below the waist. I've always used carnosine and gotten great results. But I use the carnosine, I'll put it on the back of my neck, on my tailbone, on my arms if I want. Yeah, you can place it anywhere.
Yeah.
Okay.
Yeah.
I
That's
have a question.
awesome. Yes.
So I got Rick the carnosine for his diabetes. Where would
Mhm.
you suggest putting that at?
Vicky, do
Oh,
you have a suggestion for that one?
okay. Is he wearing just the carnosine or is he wearing other patches?
Ice wave right now, and then when the carnosine comes in, he'll wear those two.
Okay. I do highly recommend the SP6 patch also.
Oh, I did order that one. Yes.
Oh, great. That's beautiful. So the SP6 patch is going to be placed on the left leg. It's called spleen 6. And then the carnosine, you can place that on the right leg, the same point, SP6 on the right leg.
Gotcha. Okay.
So that's like 4 fingers up from the ankle bone
Yeah.
is the SP6. So kind of just barely behind the tibia, at 4 fingers up from the ankle bone is where SP6 is. But you can look it up online too if you type it in. So
Okay. Thank you.
yeah, that's awesome. Is he wearing the X39 too, Jen?
He is today. He just has ice wave on his shoulder, and he's doing great.
Okay, that's awesome. Yeah. Yeah. So always because the ice wave is kind of like Advil or Tylenol. It's just a Band-Aid basically
Right.
to help break that pain. And so the what regenerates is always the X39, so the X39 in combination with other patches is what will give him the regeneration so that hopefully that pain won't come back. It'll just go
Well,
away.
right. Well, he's a hard egg to crack anyhow. That he's like, you got a patch. um so shoot, I lost my train of thought. Oh yeah, so he I forgot to patch him yesterday, and he was like, why did the pain come back? And I'm like, well, it's just a temporary fix. It's not going to heal you. And I didn't even think to put anything else on him, so I'll do that. But
Yeah.
yeah, I got the carnosine, the SP6, and then the X39 and Eon ordered.
Awesome. Yeah. Yeah. Because anytime that there's pain, there's inflammation. And so the inflammation in our body, the stem cells are attracted to inflammation, but inflammation eats stem cells. So when you utilize the X39 and the Eon together, you have this dynamic duo, this powerhouse, so that when those stem cells go to regenerate an area and reset it to a younger, healthier state, then you're going to get full power and full use of those stem cells. They're not getting eaten up by the inflammation. So yeah, so those two together are going to make a huge difference. And eventually, well, even like with you, Jen, I know you got to a place to where you didn't have to wear the ice wave very much. You could just wear the X39 and the Eon. So hopefully that'll happen for Rick too once you get him talked into a few more patches.
He was like, oh, he's like, because we were talking on our way down here, and he's like, oh, he goes, if you can convince me, Mr. Skeptical, with these patches, he goes, I got a whole host of coworkers that'll sign up for them.
That's awesome. Well,
So
I'd say you're doing a pretty doggone good job.
So I have a question on signing people up. I was looking through your Telegram, and it talks about preferred customer plus, retail. Wouldn't I just sign everybody up as a brand partner?
You can. I really go off of that person's needs. So, to me, it's more a matter of what are they going to value more? Like, do they really want the free patches that come with the preferred customer program? Or if they would tell other people about the product, then obviously the money makes more sense. So basically, they're just trading free patches for money instead. It's kind of a transfer between the two, of which.
So the preferred customer plus, they do not have the opportunity to earn commission.
Correct. It's all free patches that they get. So what they're earning is rewards dollars to pay for their own patches. Mm-hmm.
Okay. And then can they ever switch?
They can. They can always upgrade to a brand partner. Yes, at any time.
Okay.
Yeah. Vicky, did you have another thing you wanted to add?
Yeah, I just kind of base it off of the individual's needs. Like you said, if they're in and they're just trying the product for the very first time and they're not interested in it as a business, most definitely I would place them as a preferred customer. And like Nikki said, you can always upgrade, which is very beneficial because you get more patches for the package deals. But it's cheaper. So I still have my hand up. I'm so sorry. I noticed. I'm so sorry. I'm really slacking today, Nikki.
You're good. You're good.
But yeah. And some people, maybe they just want to be in it for bringing other people in. So, that's where you would say, okay, well, let's see, run down the compensation plan, which is amazing.
Yes, absolutely. It's phenomenal. Yes.
But okay, one last question about the business stuff. So if I was going to if somebody wanted to buy the patches, what is the cheapest way? Would it be the brand partner, the silver package?
So the cheapest way is the package deals for the brand partner are always the cheapest way. So gold is 30% off of retail, platinum is 40%, and diamond is 50% off of retail. So that's the cheapest way. But in the long run, this is when I, try to feel out my, who I'm talking to figure out what's best for them. In the long run, if they're really not going to talk to people about the patches very much, which I don't understand why anybody wouldn't talk to the people about the patches with the kind of results we get, but it happens. Then over time, they will have gotten more free product if we would have set them up for the preferred customer. And then they're always getting their monthly auto ship. That's always happening as well. And so that in the long run can be more beneficial for someone if they're not going to share the product with anyone else. So even though you can get a pretty significant discount with the kits, over time, depending on whether they share it or not, the free product could have been more beneficial for them. So that's just something that is kind of one of those things in talking to the person and seeing what they would prefer. I talked to somebody today about that exact thing, just talking, she's a preferred customer. She'd referred another person, so I'm attaching them to her so she can get her rewards dollars built up. And I was like, well, you're talking to people about this. Are you sure you don't want to become the brand partner? And then you could make the money. And it's just basically, instead of getting the free patches, you'll get the money. And she didn't want to. She wanted to get her free patches. So, we just have to offer it and then, let them decide. So.
And can I just remind you, I told you when I signed up, I did not want to work this business.
Yes, you did. Yes, you did. And now here you are, and it's awesome. So I love getting to work with you. It's so wonderful. Yes, very fun.
It's like Telegram, trying to figure it out. And I'll just ask her tonight where the difference was at. Like why somebody would choose the free patches over money.
Yeah. Yeah, just based on the fact that they're really not interested in a business. Sometimes too, people are on disability and so they can't earn any money. And so that's for sure, when they want to be on the preferred customer program because they can jeopardize that disability. And so it is important to talk to your people and know kind of what's going on in their life because you don't want to sign them up for the business when that could jeopardize their disability that they're on. So that's definitely something to know as well. And then there's some people that just are worried about taxes. They don't want to mess with taxes. They don't want to think about, making money because they don't want to, have to be concerned about how they're going to do that on their taxes. So, everybody has their own thing. We just have to listen and then, help them get what is going to be best for them. So.
Okay.
Yeah. Yes. Thank you so much, everyone, for coming on tonight. Thank you for sticking with us a little over time. It was so much fun. I'm glad we got some questions answered. And thank you for sharing your stories. Your stories are going to help so many people. So thank you for sharing that with us. We just pray blessing over each and every one of you. And please continue to invite people to come on the Monday night calls. We would love the opportunity to answer their questions as well. That is what we are here for. So God bless everyone. Good night.
Good night. God bless. Thank you.
Good night. God bless. Have a great week.